Hi everyone, so today we're going to be talking about the new ProAir Digital Inhaler. That's the first ever smart inhaler that was just approved by the FDA earlier this year. So it is known that there's roughly 25 million Americans living with asthma. Many of them use an inhaler during their first line regimen treatment. However, it is also known that many are using their rescue medications incorrectly, which is resulting in an increased amount of emergency room visits and medical costs. With this new smart inhaler, the ProAir Digital Inhaler, this will allow the patients to track their inhaler usage and provide data that can be worked more closely with their primary healthcare providers. So in this video, I'm going to demonstrate how to use an inhaler properly, and then we'll talk about additional benefits, like how this technology works, and then some additional questions you all might have at the end. So to start off with, the ProAir Digital Inhaler will come in a foil package similar to this one. So we'll take this out. And first off, I want to show you that back here in this inhaler, you have these numbers right here. So this one is reading 204. The ProAir Digital Inhaler will also come with roughly 200 doses. It's important to keep an eye out for this number. Whenever it gets lower to 20, the ProAir Digital Inhaler will turn red, and that is when you know to call your doctor and get another prescription for a new inhaler. So we'll start off with that the ProAir Digital Inhaler is also built with an electronic module that is located at the top of the inhaler. This is where the information will be sent from the inhaler to the phone. A smartphone, Apple, Android applications work with both phones. That's where it will be sent to, and this will be able to track the amount of usage and the flow monitor, which we'll talk about a little bit later. So I also wanted to mention that this is via Bluetooth. However, you do not need your app to be working on your phone in order for you to receive this medication. If you need to take your inhaler and you don't have Bluetooth on your phone, please take your inhaler. Do not wait and find your phone and turn your Bluetooth on and then take your inhaler. Obviously, taking your inhaler is the most important part. Also, I wanted to mention that with this app, you can actually include up to 5 inhalers with it. So if you're a parent watching this video, you can actually include, if you have multiple children with asthma that are using this inhaler, you can add 2, 3, 4, 5 inhalers into this app so you can monitor your children's usage of the inhaler. So we will start with step 1. Obviously, pretty simple. Keep your inhaler up straight whenever you are uncapping it. The ProAir Digital Inhaler will have a red cap on it. So you want to pull the cap out until you hear a click. So I'll do this one. That click right there, that obviously means the cap's out. Important to note, you don't, once your cap's open, you don't want to throw it around, lay it out, because your mouth is going to go around this. We want to keep this pretty clean. Also, don't put it upside down and mess with it. So that was step 1. Step 2, before you inhale, you want to breathe out, exhale all the air that you can, and get all the air out of your lungs. So you can do a little breath in and then breathe it all out until you can't get any more air out. And then you'll put your lips around the mouthpiece and make a tight seal around it. It's also important with the ProAir Digital Inhaler, there's a vent right here. You do not want to close your lips and cover that vent, or hold your inhaler like this. That's going to cover the vent. The vent's what's actually giving you that medication. So you'll put a tight seal around your lips, just like that. And then finally, you will push down, take a quick breath in and deeply through your mouth, and the dose of medication will be delivered to you. After that, you will try and hold your breath for roughly 10 seconds or until you can't take it no more, take longer and you need to breathe. So, also very important to note, with your ProAir Digital Inhaler, that it delivers medication in a very fine powder that you may not taste or feel going in. So do not take an extra dose of the inhaler, even if you don't take the even if you don't taste or feel the medication going in. So finally, after that, you just close the red cap firmly over the mouthpiece, so you'll hear another click, and then you just store it at room temperature. So this graphic shows the technology behind the ProAir Digital Inhaler. It shows that the sensors are at the top of the inhaler that connects to the smartphones via Bluetooth. In addition, this graphic shows how the app is laid out and the different features of the smart inhaler. For example, it tracks the frequency and quality of the inhalations. You can receive notifications regarding the inhaler usage. You can review updates of environmental conditions, and it even generates a report that patients may choose to review with their physicians, which is demonstrated on the next graphic. This graphic shows an example of the report that generates from using the inhaler. The first dotted line shows the hours and the dates of the inhaler use. The red dots demonstrate technical error, perhaps not inhaling for the correct time, while the green dots show that the inhaler was used correctly. The bottom graph shows the lung function, with the green being at the adequate levels and the red showing too low. Based on this simple report, one can see how the patients are using their inhalers and can further educate on the prevention of rescue medications and reducing medical costs. Now we have a small quiz to review what was educated on today.